Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is larynx cancer questions. Without delay, let's get started.
What areas of education should the nurse provide employees in a factory making products that cause respiratory irritation to reduce the risk of laryngeal cancer? Select all that apply. 1. Stopping smoking. 2. Using a HEPA filter in the home. 3. Limiting alcohol intake. 4. Brushing teeth after every meal. 5. Avoiding raising the voice to be heard over the noise in a factory. The correct answers are 1 and 3. The primary risk factors for laryngeal cancer are smoking and alcohol intake. Smoking cessation is most successful with a support group or counseling. Heavy drinking should be avoided since the risk increases with amount of alcohol consumption. HEPA filters help trap small particles and allergens to reduce allergy symptoms and asthma. Poor oral hygiene is not a risk factor, nor is overusing the voice. The nurse's assignment consists of 4 clients. Prioritize in order from highest to lowest priority. In what order the nurse would assess these clients after receiving report. 1. An 85-year-old client with bacterial pneumonia, temperature of 102.2 degrees Fahrenheit, and shortness of breath. 2. A 60-year-old client with chest tubes who is postoperative for 2 days following a thoracotomy for lung cancer and is requesting something for pain. 3. A 35-year-old client with suspected tuberculosis who has a cough. 4. A 56-year-old client with emphysema who has a scheduled dose of a bronchodilator due to be administered with no report of acute respiratory distress. The correct order is 1, 2, 4, and 3. The elderly client with pneumonia, an elevated temperature, and shortness of breath is the most acutely ill client described and should be the client with the highest priority. The elevated temperature and the shortness of breath can lead to a decrease in the client's oxygen levels and can predispose the client to dehydration and confusion. Then the nurse should assess the client with a thoracotomy who is requesting pain medication and administer any needed medication. The client with emphysema should be the next priority so that the bronchodilator can be administered on schedule as close as possible. The nurse would then assess the client with suspected tuberculosis and a cough. Postoperative nursing management of the client following a radical neck dissection for laryngeal cancer requires 1. Complete bed rest minimizing head movement. 2. Vital signs once a shift. 3. Clear liquid diet started at 48 hours. 4. Frequent suctioning of the laryngectomy tube. The correct answer is 4. The nurse must maintain patency of the airway with frequent suctioning of the laryngectomy tube that can become occluded from secretions, blood, and mucus plugs. Once the client is hemodynamically stable, getting out of bed should be encouraged to prevent postoperative complications. Vital signs should be monitored more frequently in a postoperative client. A swallow study is done at approximately 5 to 7 days after surgery, prior to starting oral intake. The nurse is making rounds and observes a client who had a tracheostomy tube inserted 2 days ago. See figure below. The nursing policy manual recommends use of the gauze pad. The nurse should 1. Make sure the gauze pad is dry and the client is in a comfortable position. 2. Reposition the gauze pad around the stoma with the open end downward. 3. Ask a registered nurse to change the ties and position another gauze pad around the stoma. 4. Ask the nursing assistant to tie the tracheostomy tube ties in the back of the client's neck. The correct answer is 1. The tracheostomy tube ties and gauze pad are positioned correctly. The nurse should be sure the client is comfortable. The tracheostomy tube ties should be tied in a square knot on the side of the neck and alternate sides of the neck when the ties are changed. The full part of the gauze square should be placed under the tracheostomy tube to absorb drainage. There is no indication the ties need to be changed. An additional gauze pad is not necessary. If necessary, the current gauze square should be changed rather than add an additional pad. Which of the following home care instructions would be appropriate for a client with a laryngectomy? 1. Perform mouth care every morning and evening. 2. Provide adequate humidity in the home. 3. Maintain a soft, bland diet. 4. Limit physical activity to shoulder and neck exercises. The correct answer is 2. Adequate humidity should be provided in the home to help keep secretions moist. A bedside humidifier is recommended. A high fluid intake is also important to liquefy secretions. Mouth care is important to prevent drying of mucous membranes and should be performed frequently throughout the day, especially before and after meals, to help stimulate appetite. The client may eat any food that can be chewed and swallowed comfortably. The client may resume physical activity as tolerated. A client who has had a total laryngectomy appears withdrawn and depressed. The client keeps the curtain drawn, refuses visitors, and indicates a desire to be left alone. Which nursing intervention would most likely be therapeutic for the client? 1. Discussing behavior with the spouse to determine the cause. 2. Exploring future plans. 3. Respecting the need for privacy. 4. Encouraging expression of feelings nonverbally and in writing. The correct answer is 4. The client has undergone body changes and permanent loss of verbal communication. He may feel isolated and insecure. The nurse can encourage him to express his feelings and use this information to develop an appropriate plan of care. Discussing the client behavior with his wife may not reveal his feelings. Exploring future plans is not appropriate at this time because more information about the client's behavior is needed before proceeding to this level. The nurse can respect the client's need for privacy while also encouraging him to express his feelings. Which of the following is an expected outcome for a client recovering from a total laryngectomy? The client will 1. Regain the ability to taste and smell food. 2. Demonstrate appropriate care of the gastrostomy tube. 3. Communicate feelings about body image changes. 4. Demonstrate sterile suctioning technique for stomach care. The correct answer is 3. It is important that the client be able to communicate his or her feelings about the body image changes that have occurred as a result of surgery. Open communication helps promote adjustment. The client may not regain the ability to taste and smell food because of no longer breathing through the nose, or because of radiation therapy treatments, or both. A gastrostomy tube would not typically be placed after a total laryngectomy, nor would it be necessary for the client to demonstrate sterile suctioning technique for stomach care. The client would use clean technique. The nurse is suctioning a client who had a laryngectomy. What is the maximum amount of time the nurse should suction the client? 1. 10 seconds. 2. 30 seconds. 3. 45 seconds. 4. 60 seconds. The correct answer is 1. A client should be suctioned for no longer than 10 seconds at a time. Suctioning for longer than 10 seconds may reduce the client's oxygen levels so much that he becomes hypoxic. A client has just returned from the post-anesthesia care unit after undergoing a laryngectomy. Which of the following interventions should the nurse include in the plan of care? 1. Maintain the head of the bed at 30 to 40 degrees. 2. Teach the client how to use esophageal speech. 3. Initiate small feedings of soft foods. 4. Irrigate drainage tubes as needed. The correct answer is 1. Immediately after surgery, the client should be maintained in position with the head of the bed elevated 30 to 40 degrees to decrease tissue edema, facilitate breathing, and decrease pain related to edema formation. Immediately post-operatively, the client should be provided alternative means of communicating, such as a communication board. As healing progresses and edema subsides, a speech therapist should work with the client to explore various voice restoration options, such as the use of a voice prosthesis, electrolarynx, artificial larynx, or esophageal speech. Food is not initiated in the immediate postoperative phase. Enteral feedings are usually used to meet nutritional needs until edema subsides. Irrigation of the drainage tubes is an inappropriate action. When suctioning a tracheostomy tube 3 days following insertion, the nurse should follow which of the following procedures? 1. Use a sterile catheter each time the client is suctioned. 2. Clean the catheter in sterile water after each use and reuse for no longer than 8 hours. 3. Protect the catheter in sterile packaging between suctioning episodes. 4. Use a clean catheter with each suctioning and disinfect it in hydrogen peroxide between uses. The correct answer is 1. The recommended technique is to use a sterile catheter each time the client is suctioned. There is a danger of introducing organisms into the respiratory tract when strict aseptic technique is not used. Reusing a suction catheter is not consistent with aseptic technique. The nurse does not use a clean catheter when suctioning a tracheostomy or a laryngectomy. It is a sterile procedure. A client has had hoarseness for more than 2 weeks. The nurse should 1. Refer the client to a healthcare provider for a prescription for an antibiotic. 2. Instruct the client to gargle with salt water at home. 3. Assess the client for dysphagia. 4. Instruct the client to take a throat analgesic. The correct answer is 3. Hoarseness occurring longer than 2 weeks is a warning sign of laryngeal cancer. The nurse should first assess other signs, such as a lump in the neck or throat, persistent sore throat or cough, earache, pain, and difficulty swallowing. Gargling with salt water may lead to increased irritation. There is no indication of infection warranting an antibiotic. An oral analgesic will provide only temporary relief of discomfort if hoarseness is accompanied by a sore throat. The client with a laryngectomy does not want his family to see him. He indicates that he thinks the opening in his throat is disgusting. The nurse should 1. Initiate teaching about the care of a stoma. 2. Explain that the stoma will not always look as it does now. 3. Inform the client of the benefits of family support at this time. 4. Explore why the client believes the stoma is disgusting. The correct answer is 4. Changes in body image are expected after laryngectomy, and the nurse should first explore what is upsetting the client the most at this time. Many clients are concerned about how their family members will respond to the physical changes that have occurred as a result of a laryngectomy, but discussing the importance of family support is not helpful. Instead, the nurse should allow the client to communicate any negative feelings or concerns that exist because of the surgery. The client's feelings are not related to a knowledge deficit, and therefore, it is too early to begin teaching about stoma care. It is also not helpful to offer reassurances about the change in appearance. The client will require time to adjust to the changed body image.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.